Each year, the American Hospital Association recognizes a lifetime of achievement in healthcare leadership with the Distinguished Service Award. This year, we honor Thomas M. Priselac, whose passion for critical thinking, dialogue, and open debate make him an extraordinary individual. Tom began his career at Montefiore Hospital in Pittsburgh. For the past 20 years, he's been at the helm of Cedars-Sinai Health System. In the complex environment of an academic medical center, he strives to balance patient care, education, research, and community programs. Tom is an honest and demanding leader whose natural inclination is to ask tough questions. As our chairman in 2009, he led the association with great distinction as we launched into the very challenging national debate on healthcare reform. More recently, he has chaired AHA's Political Action Committee, recognizing the importance of ensuring patients and hospitals have an influential voice in Washington. The AHA is a far better organization because of Tom's inquiry, talent, commitment, and vision. Tom's dedication to patients, communities, and the hospital field have earned him AHA's highest honor. Congratulations, Tom.
It's nothing like starting your first day with a big bang. And that's what happened with Tom Priselac. He started his presidency with the earthquake in Los Angeles. He came in, was there, helped us in terms of getting the command center established, made sure that we had the resources necessary as we evacuated patients. We evacuated 400 patients that day. And made sure that the staff who had to continue to work could connect with their family. He then spoke with the staff and assured them that we would be there for them as well as our community. It was one of those opportunities where you see leaders stand up, you know, something like George Washington in Valley Forge, and really lead and pull the team together.
Cedars has benefited greatly from Tom's leadership. Since he has taken over as CEO, Cedars has grown into a world-class institution and medical center, a great tertiary and quaternary care center, and a great research and educational center.
Tom is well respected among the medical staff. We do have a diverse population at Cedars with private practitioners and full-time faculty. Each and every one has shared their respect for Tom.
Yeah, Tom has been the driving force behind our community benefit program, and some of those programs entail Coach for Kids, which brings medical care out into underserved communities, nutrition programs in some of the outlying schools, teaching about obesity and diabetes. All of these have been initiated from Cedars-Sinai and under Tom's supervision.
Tom Priselac is well known, not by his words, but by his deeds. Tom joined forces with a member of the Los Angeles County Board of Supervisors, and they, along with others, have now revitalized the Martin Luther King Hospital, which was shut down. But Tom brought his expertise and his compassion, his concern about people who some would call the have-nots, the underserved, the least among us, to resuscitate that institution. And I think that says a lot about Tom Priselac.
I think academic medical centers benefited most particularly because of Tom's sense of the balance and the interdependence of research, education, and clinical care. Before, we had an unfortunate tendency to view them as independent silos, each operating on its own without a real need to connect them. He knew how important it was to connect them, and not only in his own institution, but for all academic medical centers, that was his emphasis.
Tom is one of those people that involves himself. He's a strong thinker. He is concerned about public policy. He is always a constructive force to try to do things that are based on values.
He was always there. He was always around. You know, he never missed anything when Matt and I were growing up. He was always coaching our teams or very involved with us growing up.
There's no end to what he would do for us. Working all day at a job like this, does some food shopping on the way home, unloads the groceries himself, you know, and then would come and engage with us.
We had this instant connection, which is like we immediately could talk to each other. He was very warm and friendly and sensitive and fun-loving. That's why after being together just 5 days, we decided to get married, I think.
My first career stop was at Montefiore Hospital in Pittsburgh. I grew up in the Pittsburgh area and went to school in the area as well. It was really two people in particular, my original mentors, the late Irv Goldberg, who was former CEO at Montefiore, and Dan Kane, who was the Chief Operating Officer. Really kind of helped me see the incredible experience that healthcare leadership and healthcare management could be. My personal guiding philosophy has been probably rooted in, respect for everyone you come in contact with. And my family drilled that into me at a very young age. Cedars-Sinai in the popular media oftentimes is referred to as the hospital to the stars, which is great because from my standpoint, people who can go anywhere in the world choose to come here. That says something about the quality of who we are and what we do. Cedars-Sinai serves the entirety of Los Angeles through our community benefit programs. That's a very important part of who Cedars-Sinai is, and it's very consistent with my own personal interest and personal values. For people coming into the field today, I would say a couple of things. One, this is, from my standpoint, probably one of the best and most exciting times to come into American healthcare since the Medicare and Medicaid programs were started. Because I think what's happened with the Affordable Care Act is really the second great change that's occurred in the last 100 years in American healthcare. And I would just urge them to constantly question the status quo and to think about how things could be different. The real reward in healthcare comes down to being involved in something that's making a difference in people's lives.